Hey, Bill Whirling here, physical therapist. I wanted to show you some things about anterior cruciate ligament rehabilitation prior to seeing your physical therapist, typically after the surgeon in the early stages, maybe weeks 1 to 2. So what we run into is the biggest problem I have, or I see when people come into my clinic at the 2-week point after they just saw their orthopedic surgeon, is their inability to straighten their knee. So hypothetically, I had ACL Reconstruction on here. I may have had meniscal involvement, either a repair or a debridement. So they come in and they say, hey, I rested my knee in a position like this. I'm using a foam roll. Typically, they're going to use a pillow. This is the biggest issue my patients have. They should know this. They should have been told. I should have told them. Somehow, they should know. But for whatever reason they don't, and then after they've done this, now they can't straighten their leg out. That's a problem, huge issue, and it's going to take a long time to fix in most cases. So do not do that. You might ask, well, what do I do instead? One of the most critical things is your ability to get that knee straight. So we recommend you take something, and a towel here works, and I put it underneath my ankle. Probably need something a little bit bigger, so let me go back to the foam roll. I put the foam roll underneath there, and you can see that my knee naturally, with the use of gravity, falls into full extension or straightness. Sometimes if you need a little bit additional push with that, you can put some ice over the top of it in the normal technique that you use for icing, and the weight of that ice forces you more into that straight position. Okay, that's an excellent thing that you can do. Of course, this is all based on the guidance that you've got from your physical therapist or your orthopedic surgeon. So also important is the ability to start to get the quads to fire again. A quad set is essentially just forcing your leg down into straight as if you're trying to push your knee down into the table. So you're pushing down like that, you can see the quads fire. Eventually you want to be able to do this, and normally a person would lie back, but I'm trying to keep this in view and so you can hear me, lift the leg. You want to be able to lift the thigh and the lower leg at the same time. So fire your quads, lift the leg as one unit. If you have what we see, the thigh comes up and then the leg comes up, that's extensor leg is what we call it, and we don't want that. I would say in your early stages, if you have a locking brace, I would lock it in full extension, lock it straight, and fire your quads and lift like that. So if you do have some extensor leg, it will help prevent that. So you're just coming up like that. If you can do it without this portion of the leg moving later than this portion of the leg, then you're okay to do it without the brace. So that's important. So we've talked about the ability to get that leg, the knee straight. We've talked about what you're going to do to fire the quads. We've talked about what absolutely not to do, i.e. put something under the knee for rest. And now I want to talk a little bit about some flexion, bending of the knee. Very important also. What I encourage people to do is use some sort of strap. Well, okay, most people end up using a sheet. So you use a sheet and you kind of take it from corner to corner, flip it around so it's almost like a strap. Okay, a rat tail, some people call it. I'm taking this, what I'm going to do is I'm under the foot, I'm going to wrap around, so it's going over the top of the leg, then underneath the knee in both cases. Then I just lie back and I'm going to bend the knee. And when I get to the point where I need to pull a little bit, I just put a little bit of overpressure on that. Again, I'm pulling the knee up with the muscles, and then I use that overpressure, and then I go back down. I would say in the early stages, do not exceed 90 degrees. So you're here. Most people in our clinic are going to end up with a brace that has limiters. You can put those to 90 degrees and limit your ability to flex to 90 degrees. So we want you to get a little bit of flexion or bend to the knees. We absolutely want you to keep that leg straight or have the ability to get it straight. We want you to work on your quads by doing your straight leg raise and your quad sets. Really, it would be quad sets and then your straight leg raise. And then see your physical therapist as scheduled. Things you should really know before you're going into surgery. You got to know how to use your crutches. If you don't know how to use your crutches, you need to contact your physical therapy clinic. If for whatever reason you did not have a pre-op appointment, that's a must-know as you're going to be using those after the fact. Thanks again. Have a great day.